Welcome, Dr. Schulz.
Hello.
I am so grateful for your time and your willingness to do this interview. It's I just think that you're a great person as this advanced counselor educator for at OSU, who is practicing currently to just give your wisdom to our master level students who are entering the field and at times may feel confused about different parts of our practice. So again, much appreciation for your time. Would you mind if we, how about that? Would you like the students to know something about you that could be meaningful to this to the discussion about assessment?
Sure, I'm happy to participate, support your effort, and ideally something of what I've experienced in my professional life is supportive and encouraging to others. So perhaps just briefly, I can say that I began my professional career in education and toward counseling as a high school teacher. I was floundering in terms of how to make a living, and it occurred to me, well, I can be a teacher. As a female, primarily, I didn't feel I had great opportunities to expand myself, and then financially as well. So I earned the opportunity to start teaching high school, and I wanted to be a social studies teacher, but I ended up teaching Spanish because I didn't coach. And in high school, if you don't coach, teaching social studies is pretty tough, or at least that was what it used to be politically. But I was really rather effective as a teacher, because I was one of those teachers where students would come to my classroom like before school, during lunch, after school, because it was a safe place. I was interested in who they were as people, as opposed to just students coming in to learn something. I mean, of course, that was part of it. And so that sparked my interest in counseling. So eventually I earned an additional master's degree in counseling, became a school counselor for 5-6 years, and then went back into education, earned my PhD in counselor education and supervision, and have been working in higher education as a counselor educator since that time, since about 2006.
Cool. I can totally see you being the person that people sit on the teacher's desk and eating an apple, kicking it, you know.
Yes, true enough. I have lots of lovely stories that really illustrate how certainly not all students, but many students gravitated toward what I offered them as a caring adult. A safe space. Before, honestly, we were talking about safe space as we do today.
Neat. Okay, do you mind if we shift into our topic?
Of course, yes.
Okay.
Not at all.
So how do you understand, Dr. Schulz, the role of assessment in the field of counseling today?
We need to have awareness and familiarity with assessment in general, and some pieces of it very specifically. We have the opportunity to help identify what is not working well for people through these various instruments. And when you use an instrument that is well designed and is reliable and valid, then it can really support our not only diagnosing accurately, but treating effectively. So it needs to be part of the process. Counseling, as opposed to, say, school psychology, we have an opportunity to decide how much we want to integrate the use of assessments into our practices. I know counselors who use them consistently and effectively, and others who choose not to use them at all.
Mm.
And that is, a liberty that we have. Certainly, much is going to depend on where people choose to work, as how much is expected of them. If you choose a private practice, for example, then you really do have the liberty to use or not use. There's nothing that states we must. But having awareness of what's available to supplement your ability to be effective is always wise.
Do you have you ever identified any boundaries of using assessment? I know that it's not, you shared, if I may, that it's not necessarily like the focus of your practice or special interest in kind of your counseling or counselor educator world. But I'm just curious about this personal piece of how do you use it? What kind of boundaries do you see as you are or choosing not to?
Well, just for me personally, like as an instructor and a trainer of counselors, I will use rather informal assessments as a tool to help students get a feel for what it's like to be on the receiving end. I do not teach the appraisal class, so my use is very informal. I don't tend to try to introduce that whole process in the other courses that I teach. In terms of practice, also more informal. I choose not to go too deeply into that process, as my interest in topics is more developmental, like personality development, relationship development, existential issues. So I'm really not seeking to treat the clearly disordered individual in a community setting. But those are my choices in terms of where I believe I'm most effective.
And kind of what I'm hearing is maybe more of a commitment to the unstructured or informal way of assessing, rather than implementing the statistically developed measures or measurements. Okay.
Yeah, like for example, I will certainly use Beck's depression inventory. That is designed really for me to use rather informally and to support my, for example, cataloging a particular client's level of depression throughout our months, weeks and months of work together. But that is something that I do not need to ship off, if you will, for scoring. So I'm happy to use those, feel very confident in using that style of informal inventory. The ones that I do not use, that I don't have formal training in, for example, is the MMPI or the 16PF. If I have knowledge of, have taken them myself, feel confident in my ability to walk through results with clients, but I'm not, formally trained or credentialed to provide that sort of service with assessment.
So the boundary would be at the training level that's necessary to implement some of those measures.
Correct.
Which almost kind of falls into ethical practice, right? Like just practicing within the scope. Is that, or maybe there is another dimension of ethical practice within a dimension of applying assessment that you could identify, or that's mostly it?
I think that's mostly it, as I believe you're interpreting it, that I am not qualified. My competence does have a boundary there. I don't feel competent in doing that. It would be illegal, besides unethical, for me to do so. And then I do have, the personalized piece is I really would rather not have that as part of my practice.
Mm-hmm.
I would rather have someone else do that piece and then let me support the processing of that. I
Mm-hmm.
think that's where my skill is probably most effective. Not
Mm-hmm.
the administration of, but the processing of the results and understanding how those fit with how a person is understanding themselves in terms of their cognition, affect, behaviors.
This is really interesting. I think that's the first time it's coming up, and I've done some of those interviews already, that it's not necessarily about the assessment or being almost like the secondary user of the assessment in the line of treatment versus in being interested in administering and scoring,
Mm-hmm.
which is just kind of an interesting flavor to it, right? Like we are competent to help our clients process through the results that they may receive from another professional with whom they complete assessment. And when I think about it, I absolutely have this experience with people who come out from MMPI with a little sheet that tells them who they are, but that they don't necessarily know how to position themselves
Exactly.
towards. So I just, yeah, I
Mm-hmm.
really appreciate this little change of angle.
Mm-hmm.
And along with that, I'm also wondering about the multicultural dimension
Mm-hmm.
as we are dealing with clients coming from all those different backgrounds, and yet the assessment may or has this tendency of, based on generalizability of all instruments, to get the validation for the instrument of
Mm-hmm.
flattening the look at the client. Do you have any pointers or thoughts on that?
Yes, I mean, certainly what comes to mind is, I mean, that's a most fundamental knowledge we want to carry as professionals, whether you're an educator or a counselor, if you're just working with folks in these sorts of circumstances, is to really understand the intent of the instrument and then how it's normed, because that's one of the first places that I want to look is how on whom was this instrument normed,
Mhm.
because if that profile fits my client, then I can make some generalized understandings about their scores with them. If they do not fit those profiles, then how valid ultimately are the scores?
Mhm.
So that would be something that I would want to make sure that the client understands about the process. And my introduction to all of that was working as a school counselor, because I did have a school psychologist who was specifically trained and identified to administer the assessments. But generally speaking, the interpretation, if you will, of the results came to the school counselor as opposed to the school psychologist. So I feel confident that I got some really good training in that
Mhm.
model in one of the first schools that I worked in. So I think that makes it relatively obvious why I continue to go that direction in
Mhm.
my current work, even as a clinical mental health counselor.
Mhm.
I I don't really want to spend my time with clients administering assessments. I much rather process,
Mhm.
but and I do clearly know that there is value in their existence. We need to
Mhm.
be judicious in however or the use of them. They aren't they shouldn't be the tool that identifies someone's diagnosis. It's a factor in identifying diagnosis, and they can be certainly helpful, but finding objectivity in anything is rather impossible in my mind.
Yes, the objectivity.
Because
What?
they cannot be
Hmm.
fully objective. I think
Right.
people do the best that they can, but even the creators, the designers of these different instruments and assessments carry a certain bias in
Yeah.
terms of how people learn, grow, change, all of that. So
Hmm.
we need to know our business in order to use
Hmm.
them effectively so they don't harm.
Hmm.
Because the potential for harm certainly exists. So,
Hmm.
you know, do your reading.
Hmm. Which kind of provides me with a segue because I'm curious about what changes would you like to see in the field of assessment that is applied in the field of counseling if you had your miracle question,
Mm.
chance.
Well, my goodness, that is a big question.
It yes, it is. Yes, correct.
I guess that's the question that you're
Yeah.
out there as well. I what initially comes to mind is continuing to seek opportunity to ensure that our students are receiving the training, the education that will help them walk away feeling confident to continue to pursue the use of assessments or to under to make educated decisions about what role assessments will fit in their practice.
Mhm.
So I don't know that always programs are efficient at assessing what our students know. Often these courses are taught by adjunct, and not necessarily is that a bad thing, but what sort of oversight is there that can be really challenging for any program.
So is it more in the field of almost like evaluation, programmatic evaluation, or
Mm-hmm.
assuring quality curriculum that would
Mm-hmm.
be offered
Mm-hmm.
to the students? Does that?
Yeah, it does. I think that does summarize the point that I'm wanting to make, because I currently am a counselor educator. That's where I spend the majority of my time. So that's what comes to me
Mhm.
initially is as a trainer, I want to make sure that our students are walking away with enough of the foundations of the work that we do that they feel confident to continue to grow and change and seek out the training that they believe they continue to need, because there's no
Mhm.
program, of course, that can address all issues in all ways.
Right.
And at the same time, we need to be clear about what the foundation is that we're providing when students are, pre-degree. So when you get post-degree, you can go after what you didn't get in the program
Mhm.
that will be both fulfilling to you, professionally, and build confidence.
Mhm.
So, choosing sites like practicum and internship sites that offer you some experiences that the program just can't is,
Right.
is also wise.
Mhm.
But it's just, being able to be discerning, I think is just always good. I need enough information so I can know what I don't know. And sort of
Mhm.
that phrase we say pretty regularly, I can say, is, I don't know what I don't know. And so while that is a reason, it cannot be an excuse for not going to find out. I need to also be uh, accountable for learning my craft well.
Mhm.
So I need to go to my professional journals and be able to digest them with competence.
Mhm.
And that appraisal class is part of being able to do that.
Mhm.
there's a lot to know, and it's
Yes, there
we have a
is.
lifetime to learn it, though. We have our lifetime. So just being reasonable,
Mhm.
but you know, and doing what it is that you're doing, you know, you're offering an additional support to those that have interest and need to learn.
Mhm. I think I think it would be so helpful to get just like a normalization in my master's program of you don't have to know everything.
Mm.
It's okay. You have a lifetime to learn. Would be nice.
Mhm.
um,
Mhm.
so, and I think it would probably have a good chance for controlling my anxiety about using assessment, or
Sure, sure, sure.
so I guess that's the reason. Yeah.
Mhm.
And just to wrap up, in a nutshell, Dr. Schulz, what is your wisdom? What would you like the incoming school counselors, mental health clinicians entering the field of counseling to keep in mind, to remember about assessment?
One step at a time. Do your best not to feel overwhelmed by the amount of information that's there or the mathiness of it, if that makes sense.
Mm-hmm.
It's really not about statistics and numbers. Ultimately, it's about how a person feels with respect to the information being provided. So you don't have to be an ultimate authority. You do need to understand the reasons behind the assessment being administered and how to support your client's understanding of it and integration of that information.
Mm-hmm.
So it's just patience, always patience.
Mm-hmm. Take it easy. Go with the flow. What an advice to a
Mhm.
graduate students that are usually pretty. I mean, you have to have a level of ambition and hard to working type qualities to be entering the grad school. So take it easy, everybody. Slow down.
Right, right. And be kind to yourself. It's it's not been a favorite class of mine. It's not a class that I've ever really felt inspired to teach. And that's okay. That's okay.
Mhm.
I still, however, need to be like, I still need to be able to have enough confidence to teach it if I were required to do so.
Sure.
I hope that made sense. I need at least that level of information that I know that if somebody said, you have to, like, okay, maybe not the first choice on my list, but can I? Yeah, I can.
Mhm.
I
Yeah.
can. And I'm going to do a lot of refreshing
Learning. Yeah.
to do
Learn.
that
Yeah.
as well. Yeah.
Totally. Okay, Dr. Schultz, thank you so very much for your time and again participation. That was really relaxing and really helpful.
Well, my pleasure. It's been my pleasure. I enjoyed our conversation truly.
Yeah,
Thank you for
thanks.
your efforts.
Yes, thank you.